All right, Jess, patient assessment trauma. You were dispatched to a rollover motor vehicle accident on the freeway.
Okay. BSI, is my scene safe?
Yep.
All right. I'm going to start off. A mechanism of injury would be a rollover accident. Is this my only patient?
Yes.
Okay. I'm going to go ahead and request for additional EMS just in case. And I'm going to consider C-spine due to the MOI.
Okay. Fires on scene. They're extricating the patient. They are saying that he was wearing his seatbelt, high-speed crash. They noticed scarring on the windshield, and his legs are the things that are entrapped.
Okay.
After a few minutes, they get him out. They have him backboarded for you,
Okay.
and that they cleared his back.
Okay. All right. So I'm going to check my responsiveness. Is my patient responsive?
Yes, he's alert.
Alert. Okay.
Yep.
At this time, I'm going to say my general impression of this patient is poor due to the MOI and the potential for serious injury. I'm going to go ahead and assess my patient for any major bleeding, anything noticeable on this patient.
Nope.
Okay. At this time, I'll start with airway. Is the patient's airway self-maintained?
Yes.
Okay. I'm going to check breathing. I'm going to look for rate, rhythm, quality in the breathing.
Okay. Was that you listening to long sounds?
That was just me listening, Phil.
Oh, okay. Equal bilateral chest rise and fall. Normal rate. Moving good air.
Okay. Any noticeable injuries of the chest, any flail segments, anything like that?
No.
All right. Then I'm going to go ahead and check my patient's skin color, temperature, condition.
Pink, warm, and dry.
Okay. What about rate, rhythm, quality of the pulse?
Rapid and regular.
Okay. All right. I'm going to treat this patient for shock, high flow oxygen, and a blanket. And I'll move on to my history taking. I'd like to have my partners try to get a sample history as well as a OPQRST from either the patient or bystanders.
Okay.
And my other partner would be getting baseline set of vitals.
Okay.
What did I get for blood pressure?
150/90. 100 for a pulse. SpO2 is 98% room air.
Okay. All right. I'll go ahead and get a blood sugar as well.
100.
100. Okay. And I'm gonna go ahead and say we'll get 2 large bore IVs on this patient.
Okay.
I'm gonna start my secondary assessment, starting with the head, palpating the head. Any noticeable decap BTLS?
He has a hematoma on his left forehead.
Left forehead. Okay. Checking eyes for pearl and raccoon eyes.
No, they're clear.
Clear. Okay. Ears. Do I notice any fluid or blood coming out of the ears?
No.
Okay. Palpating the neck, feeling for step offs, anything like that.
Clear.
All right. Airway still patent and no obstructions.
Yep.
Okay. Then going to palpate I'm going to look in the neck for tracheal deviation and JVD.
Clear.
Okay. Palpating the chest. Do I feel anything, any instability, any flail segments or anything?
No.
All right. I'm going to listen to lung sounds.
They're clear too.
Clear. Okay. Moving down, palpating the abdomen, looking for rigidity or any distension.
Clear.
Okay. Pelvis. I'm checking for instability and any pain.
Yeah, your pelvis is unstable.
Pelvis is unstable. All right. I'm going to have my partner treat that and move on. Checking for priapism and
Clear.
lower extremities. I'm going to start feeling for decap BTLS, any bleeding, anything like that.
Bilateral lower leg fractures.
Okay. I'll have my partners go ahead and splint those. Do we get CMS before and after?
Yes.
Okay. All right. I'm moving on, checking the upper extremities. Any injuries there?
Nope, he's clear.
Okay. CMS good?
Yes.
Okay.
And the fire had one of the One of the guys is a fire medic, cleared the back for you since he was already backboarded.
Clear the back. Okay, and patient's already backboarded, so want to make sure to maintain that fully immobilization of the spine. And then I'm going to go ahead and make sure this is a rapid transport. We're going to get them to the hospital as soon as possible. Treating the patient would be a fluid bolus of 20 milligrams per kilogram for this patient. And we're going to go ahead and give some fentanyl after making sure he's not allergic. So we're going to look at 1 microgram per kilogram for this patient, and then it's just reassessing the patient's vitals and rapid transport to the hospital.
Cool. Anything else you'd like to add?
I don't think so.
Cool.